It's small. It's cheap. You can buy a whole bottle for less than your morning coffee. And for decades, this one little pill has been credited with helping keep hundreds of thousands of people out of the hospital every single year. But here's what nobody's really explaining to you clearly. In just the last few years, doctors have quietly changed who they recommend it for. Some of you watching this were told by your own doctor to start taking a baby aspirin every day. And some of you were told the exact opposite, to stop. So which one is it? If you've got plaque buildup, high blood pressure, diabetes, or you've just had one of those doctor visits where they mention your arteries and your stomach drops a little, this video is for you. I'm going to walk you through exactly how aspirin works inside your body, where it genuinely helps, where people get it dangerously wrong, and one very specific heart condition where taking it might not protect you at all. By the end of this, you're going to understand your own risk better than most people do walking out of a 15-minute doctor's appointment. Let's get into it. Let's start with what's actually happening inside your arteries, because most people picture this completely wrong. You've probably heard the phrase, hardening of the arteries, your whole life. Maybe your dad had it. Maybe your doctor mentioned it at your last checkup and moved on to the next topic before you could really ask what it meant. Here's the honest picture. As we get older, a soft, inflamed buildup can form on the inside walls of our arteries. Most folks imagine this like wax lining a pipe, something you could just scrub out. That's actually one of the biggest misunderstandings in heart health, and it matters because it shapes how people think a pill like aspirin is supposed to work. Here's the part that surprises people. That buildup isn't the dangerous moment. The dangerous moment is when a piece of it becomes unstable and your body's clotting system reacts to it, forming a clot right there. If that clot blocks blood flow to your heart, that's a heart attack. If it blocks blood flow to your brain, that's a stroke. So when you hear aspirin thins your blood, what's really happening is a lot more specific than that. Aspirin doesn't touch the buildup itself. What it does is make the little particles in your blood, called platelets, less likely to clump together and form that clot in the first place. That's the whole ballgame. And once you understand that distinction, a lot of the confusion around aspirin starts to make sense. If you've ever sat in a waiting room wondering whether you're someone who should be worried about this, maybe you've got a parent who had a heart attack, maybe your doctor mentioned your cholesterol numbers, maybe you just get winded walking to the mailbox now when you never used to, you're exactly who this information is for. Now here's where it gets interesting, because this is the part that even trips up doctors and news reporters. A few years back, a major U.S. health guidelines group changed its recommendation on aspirin, and it made headlines everywhere. Papers ran with lines like, aspirin no longer recommended for heart health. And a lot of people, understandably, panicked and quit taking it cold turkey without ever talking to their doctor. But here's what actually happened, and it's a much narrower change than the headlines made it sound. There's a difference between what doctors call primary prevention and secondary prevention. Primary prevention means you've never had a heart attack, a stroke, or any diagnosed plaque. You're taking aspirin just in case, hoping to prevent a first event. Secondary prevention means something has already happened, or your doctor has already confirmed you have plaque in your arteries. You're not guessing anymore. You're managing a known problem. The guideline change was about that first group. For healthy older adults with no diagnosed heart disease, the bleeding risk from daily aspirin started to outweigh the benefit, especially past a certain age. But for people who already have known plaque or a cardiac history, the guidance didn't change at all. Aspirin still matters there. Picture your neighbor down the street who's been taking a baby aspirin every morning with his coffee for 15 years because his doctor told him to after a scare in his 50s. That guideline change wasn't talking about him. It was talking about someone who's never had a cardiac event taking it just as a precaution. Two very different situations, one confusing headline. This is exactly why guessing your way through this, or copying what a friend or family member does, can lead you in the wrong direction. What's right for one person's arteries can be the wrong call for someone else's. So let's talk about what this actually looks like in real life, because information only helps you if you know what to do with it. First, an important safety note that could genuinely matter one day. If you or someone near you is having symptoms of a heart attack, crushing chest pressure, pain radiating into the arm or jaw, sudden shortness of breath, the advice hasn't changed. Call 911 first. While you're waiting for help, chewing a regular adult aspirin, if you have one and you're not allergic, is something emergency responders have recommended for years. That's a moment where speed genuinely matters. Now, for everyday use, here's where people make mistakes nobody warns them about. A lot of folks in their 60s and 70s are also taking arthritis medication, ibuprofen for joint pain, or other blood thinners for a separate condition. Combining those with daily aspirin without your doctor or pharmacist knowing can raise your bleeding risk in ways that sneak up on you. If you've ever noticed unusual bruising, dark stools, or bleeding gums that won't quit, that's not something to shrug off. That's your body telling you something worth mentioning at your next appointment, or sooner. Here's another overlooked detail. Not all blood thinning is the same. Fish oil, turmeric, garlic supplements. A lot of people reach for these thinking they're a gentler, natural alternative to aspirin. They do have mild effects on your blood, and there's nothing wrong with including them in a healthy routine. But they are not a substitute for aspirin or prescription blood thinners when your doctor has recommended one for a diagnosed condition. That's a swap worth discussing out loud, not deciding on your own at the pharmacy aisle. And this next one surprises almost everyone. If you have an irregular heartbeat, something called atrial fibrillation, aspirin generally isn't considered strong enough protection against the type of clot that condition causes. That's a case where your doctor may recommend a different category of medication entirely. If you've ever felt a fluttering or racing feeling in your chest and brushed it off as stress or too much coffee, that's worth bringing up at your next visit, not waiting on. Beyond medication, the habits that genuinely support your arteries haven't changed in decades, even if they're less exciting to talk about. A daily walk around the block or through the park, keeping your blood pressure and blood sugar in a healthy range, cutting back on processed and fried foods, and not smoking. These do more for your long-term artery health than any single pill ever will. So let's bring this all together, because I want you walking away from this with real clarity, not more confusion. Aspirin is not a magic eraser for your arteries. Nothing scrubs plaque away in a bottle, no matter what a headline or a supplement label promises you. What aspirin genuinely does, for the right person, is lower the odds that a clot forms on top of existing plaque and turns into a heart attack or stroke. That's real, meaningful protection, but it's protection for a specific situation, not a blanket solution for everyone over 50. If you already have diagnosed plaque, a previous cardiac event, or your doctor has specifically recommended it, daily aspirin may genuinely be one of the most valuable things in your daily routine. If you're healthy with no diagnosed heart disease, that calculation looks different, and it's worth a real conversation rather than a guess. The single most important thing you can do after watching this isn't to start or stop anything today. It's to bring this up by name at your next appointment. Ask your doctor directly. Based on my history, am I someone who should be taking aspirin, and at what dose? That one question, asked clearly, can save you from years of uncertainty. You've made it through a lot of information today, and that says something about how much you care about staying healthy and staying around for the people who love you. That matters more than any pill. Take care of yourself, talk to your doctor, and subscribe the channel so that you won't miss other very informative video in future, and follow if you are watching on Facebook. I'll see you in the next one.